Hi everyone, in this video, this is a continuation video about baby Uriel's death related circumstances. And the reason why I'm making this videos is because while the death day of her death related factor people assumed was just because of the heat of the day and her being left in the car, I believe there were other ancillary factors that were leading to her weakening of health over the months she was alive on earth. And in those months when she was alive, her every little choice that was being made by her family in her caretaking related choices, in her daily life related choices of her parents, grandparents and other family, all of their choices were actually directly and indirectly, slowly impacting Uriel's health over time. And on the day of the death, of course, the being left in the car was a major factor for her death. But if there was another child like Uriel who was also left in a car for 2 hours like her, that child may not have died, may have been severely hospitalized, or may have had some moderate level symptoms if these other factors that I'm talking about in the past few videos and what I'm going to explain in this video, if these factors are not considered as relevant factors and crucial factors influencing her health or health harm, then you will not understand why a child like Uriel is dying as a result of why they died. So, and while heat is a factor, I'm not denying that it being left in the car was not a factor for her death, but that was only partial factor. The other factors, if you don't examine, if there is another child like Uriel who is going through these same challenges when being caretaken at home by the parents and grandparents or other caretakers like a nurse or a nanny, when someone else is caretaking a child with very similar circumstances like Uriel, except maybe the child is not going to be left carelessly in a car for 2 hours. If that didn't happen and everything else related to what I'm describing might be going on in Uriel's life happens in that child's life, even that child could end up with severe hospitalization or death if again the conditions related to health harm of that particular person in question is higher in their life. It will invariably lead to death. If it was really high but still detectable at a level where immediate intervention was possible for another child, that child might end up with hospitalization of the severe or moderate kind. But if no one detects what are the conditions that are influencing someone's death, what are the different steps of choices daily being made by different people, and in the case of a child, most of the choices are not the child's choices. So all the choices being made for a baby is based on whatever the parents, grandparents, doctors, healthcare providers, caretakers have been trained to do. But even though we have been trained to do many things in modern life according to what life we have led in the past and what works for us in our past and has worked in our past, sometimes the things that used to work for us in our past in helping in doing certain activities with related to child caretaking and other things, or daily choices of how you raise a child or what is considered as a norm while raising a child, those same factors that were earlier previously relevant as health safe factors, health supportive factors, can one day become the opposite of it when hidden things are going on, when even if data is present about what is going on related to some health harm, people are not connecting the dots as to how all these health harms or seemingly health beneficial thing that has now turned into a health harm, all of these things, how they are influencing a child's life. And that is why I'm making these videos, to put the focus on how past choices or past relevant and beneficial choices may not be beneficial anymore. Some past beneficial choices have to be improved in some way to keep it continuing to be beneficial. Some choices that were beneficial in the past are not going to be beneficial in our present or future if not done in the right and relevant way, specific to the health supportive conditions a particular child or a particular human needs when they need certain conditions present in their life to survive and thrive through the daily circumstances of their life. And to elicit those points only. I'm giving the baby Uriel's condition because her life is very easily to be examined, given the fact that many testimonial evidences have been provided regarding what was going on with her life. Many more evidences can be gathered about her because she was a child who died, in order to understand more the circumstances related to her death. And if the right evidence, right understanding is developed about all ancillary circumstances related to her death, any other child like her will be saved. Any other people who are also getting influenced by the same conditions in some different manner, where it may not lead to their death but it could lead to heavy hospitalization or severe illnesses, even those people will benefit from even baby Uriel's death. And that's why only I'm making this video. And in my first video I mentioned that the business practices of the two mothers, the aunt of Uriel and Uriel's mother, that is also a relevant part and factor in Uriel's life, as well as all other people who live or interacted with her or are going to interact with her family in their life. These factors are also relevant factors. So with Uriel, her mother's testimony itself, she said that she was being taken because her mother is doing primary child caretaking, but she's also doing activities related to business practices in her husband's workplace. I'm assuming they both jointly own that workplace, or at least jointly contribute towards his business functions. Because if she is spending at least 3-4 hours daily or longer time daily in that business practice, she is also equal relevant factor in operating that business, even if she doesn't legally have any name in that business, right? So if you're contributing and working in a workplace, you are part of the workplace irrespective of what role you've been given, or what legal or social whatever is the legal thing about your role. Despite the legal because I don't know, I don't know whether she's a joint partner. I don't know the partnership terms of who is the owner, whether they are even the owner, or whether they are leasing a place and working on behalf of another person who's actually the owner. All these are relevant to certain other elements, but her being involved in that business is a crucial element, which is a crucial element related to both mother's health, Uriel's mother's health, as well as Uriel's health harm that was slowly developing in her body. The health harm that no one detected, might not have been diagnosed, may have been partially diagnosed as something else, but is a relevant factor that was also influencing her health and might have led to her death when CPR was being done, and which is also an important relevant factor for many people to understand, especially with those who do similar kind of businesses as Uriel's parents were operating. Because the business name had glass name in it, I'm assuming they were also in the construction business. And if they were in the construction business, and because understand, if Florida is a place where many retirees are moving to, that is going to be a general place. I've also seen many videos about homes being made for the elderly in places like communities where elderly homes are being made for the elderly after their retirement. So many people, if they have not had a very high income life or moderate income life was their general life, they can't afford $300,000, $1 million homes in the cities in which they might have raised their kids. So in those times when elderly, and this problem of the elderly and US population, I know because I occasionally watch videos about these things. Some of these videos are just guided videos that have come to me, and I have interest, I have illness that doesn't that causes me not to be socially active or move out in the last few years. Because of the symptoms of my illness, I couldn't do a lot of physical activities. But while I was not doing physical activities, I was doing learning based. I like to learn, so I was doing learning based activities from even random videos, YouTube videos that people just possibly use for entertainment or information. But for me, it was also educational videos. So in those videos, I have seen how the elderly are moving into a cheaper home, and instead of $1 million homes, they are moving into 100,000 or even cheaper homes for after retirement, depending on the income range they have. Now, because such kind of people are moving, a lot of construction activities related to that could be part of the business activity of these both the aunts, because one's business has a roofing name, another's business has a glass name. And if people want to do more, I did check the roofing businesses services, I didn't check the glass businesses services. But whatever business they are doing, if let's assume they are indeed in the construction business, one thing related to construction that I have also faced in India, and which is a major problem in India, much more slightly more severe problem also in India, because in India we have particulate matters of construction dust that can be very very toxic to people. And both in India and in US, if construction work is being done and if construction workers do not wear masks while doing their work, if people who are hanging around also in that construction businesses official premises, and there if some kind of welding and breaking of glass or reconstruction of material related work is being done, whatever work they are doing, if the premise at which Uriel was going with her mother, some construction related work was like maybe minor construction, but even if 10% construction related some work was being done there, understand that if that kind of work was going on in that premises, and dust particles and microparticulate matter were present in that work environment, then that microparticulate matter related inhalation also could have happened to Uriel. And if while caretaking the child, I don't know how much the dad was caretaking the child, or whether if let's say there is some problem occurring with a client, because when you operate a business, there's invariably sometimes business related challenges will come up, challenges that you cannot resolve just by simply talking on the phone or texting. At that point of time, depending on how involved the mother was, how involved the father was in their business related dealings, sometimes he might even have to go to a particular location with the baby to go and resolve client issues at the location where the construction work might be done. And did she do that or didn't do that, I don't know, because that question hasn't been asked. But if not for Uriel's case, if in the future she also caretakes other babies, and if she's taking those babies with such future decision making, if with Uriel this didn't happen, doesn't mean that this can't happen with another future baby when they're carrying the baby to the premises for going and talking about construction related work. But if you're traveling to a construction area, or if minor level construction things were going on in the office itself where the business is being operated, in those time points, because construction work generates dust, and I have had in my I don't work in construction, but the areas where I lived in the last 10 years in India, both the areas have heavy construction going on around my neighborhood, as well as my neighbors above me were doing construction related work and repair related work. And when construction and repair related work is being done in India, we have cement houses and houses that have been painted with similar kind of paint which are used globally. So acrylic paint is used globally, and acrylic paint related problems and some common paints that are used globally in many countries of the world, those paint related problems when construction work is done and some shaking of the building is happening, repairing is happening, some movement is happening, mobility is happening in breaking down certain structures, at that time a lot of construction dust is generated. And some construction dust being common elements like paint materials, they will have the common factors globally influencing people's health. And some other construction dust, depending on what kind of other materials are used for doing your construction work, those materials, microparticulate matter, will be influencing your health. So if these people with their glasses, what kind of glasses they use in doing their construction, they could be in India or in US. I have lived in multiple homes as a renter, or lived in homes of friends and family when I visit them. So I know that you can have microfiber plastic related materials for your windows and glasses. You can also have actual silicone glasses as well. So whatever is the material used for glasses, understand that that material's microfiber particles, if in the air for glassing purposes, and even for glass removal or changing of glass or breaking down of glass, or any other reconstruction related work that you're doing, some dust particles of whatever material is being moved or shaken or will go into your lungs when you are around that area. So baby Uriel's health, where let's say she was diagnosed with some, she was coughing a lot or showing some symptoms where the doctor assumed that the child is having cough because of general cough that in that area during summer time or winter time a child can have. So the doctor might have given the child a inhaler, or for lung infection related, respiratory tract related infections, they could have given her some medications like corticosteroids or something for breathing better. That could be a medication that Uriel might have been prescribed, assuming that everyone is assuming her cough and her other health symptoms were because of either seasonal allergies or local flus that can transpire during this winter time, or any other time when she went to the doctor for checkup and something was found in her. But if the doctors, and this is why also in some of my previous videos I have the importance of doctors asking more crucial and critical patient history, why it's becoming more and more relevant now is necessary. And not just doctors, if a child's death has happened, medical investigators also need to ask some deeper questions about the ancillary circumstances surrounding the child's caretaking and daily activities and roles, because they also influence a child's overall health status. If a child dies, or if a child gets severely hospitalized, or if even a child is going to a doctor for normal therapy, where if you normally assume in case of anyone who was not Uriel and who was just leading a normal life where the child is just going to daycare and coming back home, or living in the home with the parents, at that point of time what will be influencing the child's health? Definitely at that time seasonal allergies will influence the child's health, because if in the locality some pollens have been released, the pollen can lead to seasonal allergy. And if the child is only staying at home with the mother, then the home's conditions will be influencing the child's health, and if there is mold in the homes, mold related allergies could crop up. And in the past, this is the normal pattern most children used to have. So if most children used to have these kind of patterns were studied and diagnosed, and then the medications for these kind of patterns were designed, and that's why you will have anti-allergy medicines related to pollen or pollen related factors, or that is helping a child breathe easily, or and if it is an allergy, that is allergen that is causing this cough and other symptoms that are being considered as a allergic response. But this is where now crucial scrutinizing of any child's health needs to start happening globally for multiple reasons, and reasons specific to the child, reasons specific to the location where the doctor is operating, reasons specific to also multiple reasons that could be influencing a child's health than just the simple presumed allergies or presumed flu or presumed bacterial infection that usually causes children or babies to have particular symptoms. Because the same things, that if mold can also lead a child to cough and sneeze and have watery eyes and have a deep chest related cough, but if food has fungus in it, food related problems can also cause that. If your home has fungus and mold, it can cause that. If your workplace, now this is an additional factor in case of baby Uriel, if your workplace environment, she's not working, but if she's been taken by the parent to those workplaces, and sometimes in some of those areas, like even if no construction was going on in the business office where the mother works and takes the child with her, or if the father also is occasionally taking the child with him, but if the father is using his truck or other vehicle to go to the construction site, and he comes back from the construction site and construction dust has settled in his car or in the mom's car, they didn't take the child to the site, but if construction dust has settled in your car and you haven't vacuumed the car, and you understand this, young parents are very busy also sometimes, and when you are young and also operating a business, that time also there are phases and crunch times when you might be super busy, and if you're facing those crunch times where you're super busy, and in winter time if snow start, I don't know, I don't think Florida has snow problems, but in other cities where snow is going to now start falling in the winter, so before winter many people might want to finish their activities of construction, so people might have a crunch time in October or September because people want to get it done, or in winter time people might want to go for holidays, so before their holidays they want to get their construction things ready, or in winter time because people have holidays, some people might want to move into their homes during November time or December holidays or Thanksgiving holidays, so before that they want all their construction thing settled, or because holidays are coming, family is going to come, if reconstruction of home is going on, again they want their home to look beautiful before some family comes and visits them. So do you see, all these factors can influence now the business of their business practices getting a lot of workload from September to November beginning possibly. So at that time, if the parents are also very crucially continuously busy, those are the times when they might rely on some caretaker or nanny or grandparents to help the child stay with the grandparent while the parent is busy going and doing their business activities, right? So that business activities, family activities, because when she's a mom, she went back home. Why? Because she went back home to make dinner. She has, if she's caretaking 4-5 children, they have to do home caretaking activities, cleaning activities, laundry might have piled up. And understand this, most women are doing a lot in terms of multitasking all the time in their life. It is irrespective of whether you are a housewife, whether you are partially working, whether you are completely working, whether you are a mother. Many women, majority of the times globally, are taking care of a major unpaid share of work at home life, as well as sometimes some women, if they are business partners to their husbands or unofficial business partners to their husbands, they do this, they work in their offices also without getting paid for any of these activities, but they do a lot without getting paid. And that doing a lot is important. Why? Because if a woman is doing a lot for your business, doing a lot for your profession, really, a good life partner to you, they will be doing things without asking anything in return. And while doing those things without asking anything in return, if now the woman is falling sicker and sicker, but the man is not observing this about the wife, while women usually caretake the spouse, many men do not observe when the wife is falling sick or something is happening to the wife in terms of their health. And this is also a crucial factor. Because why is it a crucial factor? Because I feel Uriel's mom is also slowly starting to fall sick. The reason why, if she's this is a subconscious pattern which I've discussed in some of my videos previously also. What can start happening is, this construction dust related material that you're inhaling, while a man usually being, and if you look at Uriel's dad also, he's a robust person, taller person. Mom is a shorter person. She's also a little bit robust, but she's still in height a shorter person. So your body structure, body height, body biochemistry, and the biological differences between a man and a woman, as well as a biological difference between a man, woman, and a child, these are, and a girl child and a boy child, these are also all ancillary factors that influence the overall health status of a person, even when two people are being exposed to the same type of toxin in the same area. That's why something that majorly impacted Uriel's health will, if that there is an environmental condition like water pollution impacting people's health, everyone in that locality will have the water pollution related problem in a different way, depending on how much water pollution is there, what amount of the water you have consumed, what else you are doing. All of them will determine the water pollution's impact. Same way, in the same office, while Uriel's dad is potentially possibly working 10-12 hours in that office or in the construction sites, mom is working only maybe half the time in that construction site. But for mom, what will be influencing her health? For mom, the construction site, office, and home, and anywhere else the mom is going, like the beauty parlor, all these places are influencing her health. So every one of them is getting some parallel health impacting factors influencing their health, and some divergent health impacting factors influencing their health. So let's say the dad in the evening sometimes goes with his friends to a bar occasionally, and then the bar's atmosphere, the drinks he has in the bar, the food he consumes in the bar will also be influencing his health. Or he goes to a business meeting with some business partners and they go to a restaurant to eat food. That restaurant's food and drinks that they are consuming will also influence his health. Or if he has his own family, that if he has that other women, I don't know if that is true or false about them, or if he doesn't have any other women in his life who's involved in the other child's caretaking, but the other child's health, if the other child is now falling sick for some reason and there is indeed another child involved who has a different home, that child's home circumstances and life circumstances will also be influencing that child's health circumstances. The dad also, if dad also has some parents, right, so if he goes and visits his parents and siblings, or if their children are spending partial time with one grandparent some days and another partial time with another grandparent or another sibling of the dad some other days, at that time that person's home circumstances and social life can also determine how a child's health can be impacted slowly over time, and then multiple factors given in combination together can lead into a major health impact. Now, why glass is important, because I actually saw a video recently where some glass related recycling factory was doing some glass recycling. And in that factory, the people who are working there, those who are directly handling the glass materials for sorting and crushing of the glass, there, visibly you can see dust particles of glass in the air. And because you're visibly seeing dust particles, you are more careful. So the people who were working in that area were wearing masks. Some were also, and if you have seen glass blowing videos where people are blowing glass to make beautiful glass pieces, vases, bottles and things like art and other artifacts, in those glass blowing areas also you will see the people who are working with glass, they will be wearing masks, they'll be wearing glasses, so that these particulate matters from glass doesn't get inhaled by them or doesn't go into their eyes. They'll also be wearing gloves because of the heat related factors, but gloves is also important. If microparticulate matter of glass hits your skin, it will also have a skin impact. But while the people who are doing glass blowing industry work, they have been doing that glass blowing industry work for many centuries, and because of which many safety protocols have been implemented in those industries based on centuries of work being done. But glass recycling work hasn't been going on for centuries. So some things related to care that needs to be taken when working in glass recycling related work hasn't emerged. Similarly, construction related to glass, earlier the homes didn't possibly have that many windows, or people didn't used to do reconstruction of their homes because people were just barely surviving in earlier times when you were just having enough money to buy a house. But nowadays there are many people, especially retired people, can have discretionary income, as well as people who have some good socioeconomic status, they can have discretionary income. And this is a pattern of people with, I have seen myself, my friends and neighbors who have more discretionary income than me, they go into renovation activities, unnecessary, sometimes necessary renovation is needed in certain places, but sometimes just because you have a discretionary income or you're too bored with the normal status of your house, people decide to do discretionary, they use their discretionary income now to reconstruct your house, rebuild your house, build more floors in your house, do some other construction work in your house, right? So these are the kind of work both the mother and the aunt's businesses likely get involved in, because Florida is a little richer state, so there will be more discretionary income. Or if retired people and some rich retired people are settling there, they would also be doing all these more discretionary income related work, right? But which also means, while this was not prevalent like let's say 30-40 years back, now that this kind of work has gained prevalence, Again, the work hazards related to this kind of work, if not scrutinized deeply, if not understood deeply, if I don't understand it, does it mean that if I don't know that dust particles from construction in my neighborhood is going to impact my lungs, will it stop impacting my lungs? No. So if there are 100 people living in my building where construction is going on, either in my building or outside my building or both, and if all the 100 individuals who live in that location do not understand that air pollution, microparticulate inhalation is impacting their lung health, it doesn't stop them from the microparticles impacting their lung health. The only difference is the one who is more aware will be most probably the person who has the most health impact from those particulate matter, one who might be most sick, one who might be most educated about that field of work, one who might be just educated about health related parameters, one who might be educated about all these multiple levels. So those are the people out of the 100, maybe 5 of them will be informed about one or the other. So if someone, if there 100 people are staying in a locality, construction is going on around there, and I'm saying 100 because India is a real populated country, so 100 people can easily stay in just simply one building in India. So in one building, if construction work is going on, 100 people are living in that building. Out of the 100, the one who works in construction might or might not know about construction related health hazards. When will that person know about construction related health hazards? The more mindful work he does, the more better he will have information about what construction related work can do to someone. The one who is more involved, the one who has higher level position in those works, the one who has more depth of studying knowledge related to that work. And do I need to be in construction to know that construction dust can cause health harm? No, because I am a healthcare practitioner. I don't need to be in construction industry to know what can cause health harm. I just need to be a healthcare practitioner with the right knowledge to understand how construction materials can lead to health harm. And construction dust is been one of my allergens in one of my allergy testing. House dust, construction dust, all these different particulate matters of local environment dust were some of the written diagnoses that I got when I did some allergy testing. But if that allergy testing was done later, before that allergy testing only, because I am a mindful person, when house dust was generated or construction related problems were escalating my breathing distress, I knew that the construction material is one cause of my breathing problems. And because I knew the construction materials is one cause of the breathing problem, I was now searching for a different home where I could stay. And it's not that I because if I know that there are, and for me it was not just one factor related to just construction dust impacting my health. Same way for baby Uriel also, it is not just one factor that was impacting her health. So if there is mold in the parents' homes, that might need to be checked, because mold poisoning can also cause these fuzziness in thinking, and you may have some you might want to, like with my videos, you will see some of my videos I say I want to say something, but I instead don't finish the sentence. I may have some gaps in my previous video itself. I have made some errors. I didn't rectify those errors. Usually in many of my videos I do put edits about the errors I made, but these gaps I have left and I haven't even edited for you to figure out what gap did I enter there, what was it I was meaning to say, so that you understand that this is what happens to people. Like, and I do have mold and fungal problems in the homes I am residing in. So the mold and fungal problems does impact can have the potential to now impact my speech also. The speech, where the speech is not impacted because I don't have clarity of speech or clarity of thoughts. I cannot talk on all these topics at such a great extent if I didn't have some clarity of thought and clarity in speech. But I'm still making speech mistakes. Why? Because sometimes if toxins are there in your blood and toxins are impacting your nervous systems, CNS systems function or brain functions or speech functions, at that time you will have these gaps of thoughts, gaps of memory lapses, gaps where you're not able to say something. And there's not only just mold poisoning causing it, but combination factors can be causing this. So some of the factors related to the mother's testimony related where she said that the officer might have come around 3 or 4, when actually the officer couldn't have come until after 5, because the officer himself in his notes has said he went to the scene at 5 o'clock. So if he did all his scene related things around 5 o'clock, he couldn't have other officers couldn't have come to their home until around that same time. Like if 911 dispatched someone to the parents home, dispatched someone to the grandparents home at the same time, they might have reached there at 5. But if 911, the same officer who went to the grandparents' home, then went to the hospital, and then went to Uriel's parents' home, then that same officer couldn't have reached the home until after 5, because I don't know now in his notes also what he meant by when he, sometimes, this is how do I understand this aspect is when I was doing some operation related work in hospitals. At that time I was tracking, how many minutes it takes someone to do some work. So I was writing some timelines about those things. But sometimes when you are having a very busy day, you may write 5 o'clock. But that 5 o'clock could be that at 5 o'clock, around 5 o'clock maybe, he might have reached the grandparents' home at around maybe 4:45. Then he went to the hospital at 5. Then he went to Nicole's I keep saying Nicole, I don't know why. Some Nicole related person might be involved in this case possibly, or some other Nicole like kids case might have to be investigated like that. I don't know. But this is the error that God has given me. But this Uriel's parents, when in Uriel's parents' home the officer reached, he might have reached around 5:15. The whole thing might have been happening around 5 o'clock. So all these timelines also of her thing might need to be verified simply for understanding deeply what is going on with each person. One person who has made a note saying 5 o'clock, he could have made a note in general about the whole timeline of the half an hour or 45 minutes work that person did. In that half an hour, 45 minute, 1 hour of work, that whole timeline range was somewhere around that 5 o'clock zone. Because some people are very particular about time and they're on the dot all the time noting at 5 o'clock I did this, 5:15 I did this, 5:30 I did this. But some people, and he was near retirement. So when you're getting near retirement, or the particularization of what time you need to note down and things like that, that's a practice that has emerged now in modern practices of healthcare or legal systems. Earlier, people didn't used to be that particular about time, or if you have lived also in a very not that busy city life, this is very important in city life. But if you've been living in a county area where not high density population is there, and a general sedentary lifestyle like approach is there, a very sleepy kind of a lifestyle is there. Sleepy meaning it's a chill lifestyle, much more chiller lifestyle than how you will have when you live in a major city. At that point of time, understand, many people will have this vague idea also about how their day is going, because you're not paying attention too much. Because if I have a relaxed life, if I'm not in a hurry to go anywhere, if I'm not scheduled, and usually my lifestyle is approaching that life where I'm not in a hurry to do many things, at those time points you will become very less observant of time, which has happened to me in recent years. When the more I don't work professionally online, and I am more particular about time when I'm working, I have a 9 to 5 job, 9 to 9 job at those time points, or I have to go to school at 9 o'clock in the morning at those times, or grad school at 9 o'clock. At those times I am particular about time. But the days when I don't have work, when I don't have that many workload, when my workload is easier, at those time points I'm not very particular about am I waking up at 9, am I doing lunch at 12. No, I don't do that. So that's why also Uriel's mother may not have had a good estimate of the time. But a good estimate of time does get fudged by when you have a easy lifestyle also, when you are falling sick also, when something is chemically or biochemically impacting your brain functions also, when you are having problem recalling, or you feel 2 hours has passed but actually 4 hours has passed. All of these things are relevant to Uriel's case and Uriel's mother's case also, because it can have relevance in future child caretaking practices. Because if they are going to construction sites where glass particles are being inhaled, now because it's not a glass recycling factory, or a factory where glass manufacturing is happening, or a factory where glass products are being made, made, the same safety protocols that those people wear related to masks, related to eye gear, related to protective clothing, the mother may not be doing it, but that can also impact your brain function and body's function, because let's say they are heavily involved in glass related material usages and other construction materials are being inhaled by them in their work practices. It might be lesser amount is being done by the mother, but mother is also possibly, if she was postpartum depressed and given some medications for depression, that medication will also fudge your brains. SSRIs can also do it. I didn't mention it in the previous video, but if the mother is taking an SSRI, that SSRI can also via breast milk go into the child. If the mother is taking any other drugs that have some of the drugs have a potential to go from the mother into the child, and it is both the legal drugs she takes, illegally if someone has inserted something into her food or drinks, that can also impact her. If if environmental pollution related drugs are also present in her water and food, then also it can impact her. So do you see each level of impact just increases? If 5-6 different things are impacting her breast milk, all those 5-6 different things will impact the baby as well. If one thing is impacting the mother's health and mother's breast milk, that one thing will be impacting the child. Does that make sense? One thing related to the mother and a child that is being breastfed by the mother. But then apart from that, other factors are also there, which I've already discussed in the previous video and in this video that I am discussing, where now for if the glass related thing is the glass particulate matter, if inhaled by any adult or a child, they are very microscopic particulate matters of inhalation. So glass can also cause glass related poisoning. That glass related poisoning, that microparticulate matter can either settle in your lungs, related cause rupture of your lungs, cause rupture of your blood vessels, cause, if it has migrated via your circulatory system into rest of your body, any other body parts where that glass microparticles are settled, and if it is very sharp glass, and the sharper the material that was inhaled by you, because it could be glass that could have been inhaled, it could be asbestos, it could be lead, it could be other acrylic paint, when paint related materials and construction work is been going on, all of these, when it is getting inhaled by the child, by the mother, it is also impacting the cardiovascular circulatory system function. And imagine now if the child has some glass particulate matter, we don't know the child has inhaled glass, but how do we understand the child could have inhaled gas is from the fact that if someone does a forensic analysis of the site where the mother used to work or has traveled to, when similar sites where similar level work is still going on, in all those areas, if you do microparticulate analysis, fiber analysis of those areas, you can find if glass particulate matter, other microfibers of other toxins, environmental toxins were present in that area. And if environmental, like just physical environmental toxin, not even the chemical one, these are the physical toxins that could be present, physical toxins that could be inhaled by someone who is going around in those areas, and the physical toxin after inhaling will, if initially small microparticles have been absorbed by me or consumed by breathed by me, I will cough it out. And even it can be drunk by you also. How? Let's say you have a sippy cup or anything, a glass of water is presented to you, or a bottled water is there. In order to drink the bottled water also, sometimes I may have to open the lid. In order to fill the bottled water also, sometimes I may have to fill the lid of a bottle. Or if it is a glass like this, where I go to a water source and fill it from the tap, and then I'm drinking it, and in my home environment or work environment, microparticles of something is there that visibly my eye is not able to see, or some negligible amount I can see but I'm ignoring it. But if it has fallen, those microparticles of fungus or dust or mold or construction dust or glass dust or roofing dust, something has fallen on it while I'm drinking this water, is it going to now go into my body circulatory system eventually? Some of it might be eliminated. If small amount has been consumed very rarely by me, I'll be in a more healthier status. If enough of it has accumulated in my body, it can accumulate in my liver, it can accumulate in my kidney, it can accumulate in my heart, it can accumulate in my lungs. Liver kidney accumulation will happen if more of it is happening via drinking. Heart lungs accumulation might happen more when it is being inhaled more. Okay, but heart related problems can also happen both via drinking sources, food sources, inhalation sources. So do you understand, different organs will be impacted by the different ways in which you got exposure to some toxin. And then if that child was in any area accidentally just one time, also in that one time only she can inhale a lot of things, and after inhaling she was coughing, so the mother assumed that because it's flu season or because it's pollen season, if let's say the mother had a history of pollen allergies or someone else in their family had a history of pollen allergies, she might think that allergy is going on. So she could have gone to the doctor, she may not have gone to the doctor. Even if she went or didn't go to the doctor and she assumed that some simple allergy is going on, at that point of time she or the father or anyone else getting the child assume that some simple coughing is going on, simple allergy is going on. You might have done some home remedies. If you didn't do home remedies, you did take the child to the doctor's appointment and the doctor assumed it's just seasonal allergy or something. But when in fact the coughing was happening because microparticles of glass have settled in her lungs or in her, now from there it might also go into her heart. And if it is very sharp microparticle, then what is happening is, if you say you are giving CPR to a child and a gentle only CPR is being done near the heart or near at that point of time, if a gentle CPR is being done near the heart but pin pricks of glass is there, do you know how hurtful it is when your hand gets hurt by even microparticle of glass when you touch something? It pains a lot, right? It can also lead to bleeding sometimes, it can also lead to open wounds sometimes. Like that, if one small speck of glass, if any one of you has ever broken glasses in your homes accidentally or deliberately, and you got injured from the glass while collecting and cleaning up the mess of a broken glass, when you're cleaning it up, some microparticles sometimes even hurt our hands and foot, right? So those microparticles that can injure your foot, that can injure your hand, even if it is even smaller in size than the particle that injured your foot and hand, internal organ wise it can also damage, because some of our capillaries and veins and other systems of the body are much more delicate inside the body than outside. Our skin and hands have a little bit more thicker skin because of the fact that it gets exposed to a lot of environmental elements, but the internal organs of our body are much more softer in nature, much more delicate in nature. So the same particulate matter which might only, and have you ever had paper cuts, which even a sharp paper cut can sometimes lead to bleeding for some of us, or at least an injury. So paper cuts, glass particles us getting stuck in our hand, wood splinters getting stuck in our hands when doing some woodworking or other wood related activities, and all of these instances when, or even a thorn stinging you or in a bee stinging you, all of these can cause a kind of sting and injury that on the outside skin, while it is very simpler injury or easily manageable injury, sometimes leading to bleeding, internally it can lead to more bleeding, internally it can lead to more health harm. And those glass particles, if accumulated in her lungs and chest while doing CPR, could have also ended up health harming her, because no one knew that glass might be there in her body. Whether it was there in her body or not, I'm not saying, I can't tell, that needs to be investigated. But do you understand that was also responsible then for her death? And is it necessary to understand that for another child or a few other children who might if Uriel's parents are taking the children to the workplace, you might decide that other people can also bring their children to the workplace. So if a few other people start bringing their children to the workplace, it's important now for you to understand why, even if visibly you can't see any particulate matter in the air while doing your work, doesn't mean that microparticles aren't there, and doesn't mean that those microparticles will not impact your child's health if the child was not wearing masks, or if the child was not wearing glasses, then it will also impact. And then imagine if she has inhaled also and some of it went in her eyes also, her eyes will also look watery, and she's a baby, so babies will not be able to even tell what is wrong with their health. A baby, so until 3-4 years of age, when children are exposed to such environments, they will not be able to verbally tell what is going wrong. Via their symptoms you have to understand what was going wrong. And that's why only mindful and careful observation of the child's symptoms are very necessary for all medical examiners who are examining accidental death of a child. And many a times, if parents are very busy either doing housework or doing professional work or doing both, at that time parents' observation of these things will not be high. If they are mindful parents, thoughtful parents, very ultra careful parents, then you will be observing it. But let's say what also happens with women many a times, which is also another problem in women's related health, people need to start understanding this more deeply, is like if the women becomes really women usually, or the feminine energy in a person, which can happen in a man if a man is more feminine in the relationship, either of them can become ultra cautious when you have a baby to caretake. Universe usually will, if you have been biologically carrying the baby for 9 months, in those 9 months you're getting slowly familiar with the baby's health, and you're also gaining some insights about how to keep the baby safe. So when a baby is born to a woman, you will see many men make fun of their wives when wives are, ultra cautious that the house needs to be clean, or the diaper table needs to be cleaned in a particular way, or the bed needs to be arranged in a particular way. And if men are not attuned into their partners, for them it seems like a overly cautious thing the wife is doing. But usually, if you are really empathetically attuned and intuitively attuned to your child's needs, women are doing this for the safety of the child. That safety mechanism has been triggered in them to become overcautious about whatever unsafe things can be eliminated from the child's health. Because the greater the degree of unsafe things in the child's life, the impact will be on the child's health and the woman's health, because the women will have to do more caretaking. Like many spouses you will see have fights also in their marriages when the baby is being raised from infant stages to 2-3 years of stages. At that time, if the mother is very careful and the father is not attuned to why the mother is that careful, they will think the mother is being stupid, the mother is being silly, the mother is being overcautious, when the real thing is the mother has been energetically and intuitively attuned to whatever factors should be eliminated from the child's life that brings unsafety to the child. Now, if the mother is more feminine, she will be doing that. If the father is more feminine, they will be doing that. If they are consciously more feminine, they will verbalize all the things that needs to be done, needs to be in place, and actively and proactively doing all these safety features. But if you're not that energetically tuned, meaning like the person who will have that energetic tunement, higher level of intuition related attunement to the child, are those people who are mindfully doing many activities in their daily life, those people who are doing meditation and other health supportive things in their life. So the clearer you keep your energy and your thoughts and your life, and more intentional is the choices you make in your life, the clearer you will be with your babies related things as well. Whereas there are certain people who have had some life problems, who have had some health problems, all of which reduces the functional clarity, functional mindfulness based choices of someone. But at those, and apart from that, if some disease might be unfolding in your body, that will reduce your functional capacity. Apart from that, if business related problems are cropping up in your life, that will lead to some functional distortions, because you're divided now in your concerns, right? So all of these things can start manifesting in your life. But why is it important is because when all these troubles are now manifesting, if and that is when what happens to a woman, husband may not understand what the woman is saying, husband's capacity to understand the woman might go down, then the woman might get depressed, which is, or the woman's lack of support and care that she needs from the husband to ensure, like the days when she is not able to keep the house clean, the husband has to pick up But if the husband is not picking up, if not husband, if they are rich enough, they need to hire someone to pick up that pace of keeping the house at the same safe and health safe level for a child and everyone else. Because if the child is sick, understand that the sickness of the child also influences overall the parent's health also, and then it will also influence eventually the business function, social communication related aspects of that family also eventually. So that's why every step you take towards safety reduces your future problems of life, and every step you take towards health supportiveness of a baby and a woman, the future problems of a family's life gets reduced. But the every step you take to the opposite direction, or every step you take thinking you are doing some safety things but it is not safe, those times are the time points when the opposite can start happening. And that's why also it's important to understand Uriel's case and case of other babies who are presenting, like if their parents are taking sometimes construction related tours, if they're not taking the child to the construction site at all, but the child is still traveling in a vehicle in which the father has gone to a construction site or the mother has gone to a construction site, the vehicle might still have particulate matter that the child can end up inhaling. Because when the vehicle is shaking, when you're driving a child in a vehicle, you've never taken them to any construction place, still some particulate matter might be there in your cars that you didn't vacuum, or anywhere. If you live in a very polluted city, this particulate matter pollution doesn't need to be a very construction industry specific thing. It can be a global thing again, where if you live in a city or a village where a lot of micro particulate pollution is there in your air, that air pollution factor, everywhere you drive your vehicle, those micro particulate matter is settling in your vehicle. If you don't vacuum your vehicle regularly, don't ensure that the dust particle settled in your vehicle has been cleaned appropriately, again, those particulate matters could be there in your car, and your child will be sneezing and coughing and showing symptoms, and you will decide, I'll give medicine, the child will be okay. But when will the child be okay? The child will be okay if there's only one factor influencing their health, or very simple factors influencing their health, and a little bit of medical intervention is enough. But when major factors are influencing their health, complex factors are influencing their health, multiple things are influencing their health, that is the day when the child can fall severely sick. Child can be on the track of being severely sick with no one understanding that severe sickness was going on or building in their body. That is also one of the reasons why sudden infant death and other infant related deaths can happen in a child, where something was already slowly manifesting that was going wrong in their body, and then whatever was lastly detected as the cause of their death, and in this child's case the 2-hour stay in the car was the last cause of her death, but everything else was also building up and adding to her overall health harm. Everything else that, if prevented by everyone concerned, will not lead to that level health harm for any other child, will not lead to even severe hospitalization for another child with similar life circumstances, may not lead to unknown and undetected health harm continuing. Because if she had glass fiber or microparticulate matter related poisoning going on in her lungs and cardiovascular system, that is an undetected health harm that was going on, undetected and undiagnosed health harm. Or if she had gone to a doctor for diagnosis, it might have also got misdiagnosed, because people are not aware of the parent's life, people are not putting 2 and 2 together about even let's say there is no parent who is in the construction business, but the parent is living in a city with a lot of either construction going on or other city pollution factors in their area are there, or you're living in a village where factories are there and factory related pollution are there in your area. Now if the doctor has not put 2 and 2 together, that doctor is still prescribing and practicing medicine from 10 years back, when in October time everyone gets flu, or in December time October time people get pollen allergies, or in spring time people get pollen allergies, or some seasonal allergies are happening. That is old school paradigm of 20 years back, 30 years back, 40 years back, when all these parameters that I'm talking about, these newer ways of living oriented health factors are not been examined, are not been investigated, are not even been understood. And some of these things you have to now, you can't use if it is a poor county, or if it is a poorer low cash strapped family. Those poorer family, poorer counties cannot afford expensive medication, expensive hospitalizations, long term treatments for some of these patients. For those people who don't have enough finances, those people who have job losses, those people who have multiple other life challenges where they can't keep taking a child again and again to the doctor. Like for simple diagnosis related to cancer, I had to go through the rigmarole of at least 5-6 medical professionals. Even then I still didn't get the right therapy, because two types of cancer were going on in my body, and no one has wakened up to the fact that two types of cancer condition could also be developing in someone's body. Or not just two types of cancer, for me organ damage was also developing in my body based on my patient specific factors. The factors, half of which I narrated to them, some of which I was hesitant to narrate because it sounds crazy to other people if I say someone is deliberately trying to poison me. But I have a relevant and valid reason for someone trying to deliberately also harm me, not just the inadvertent harm. And that valid reason I'll discuss maybe once the data for that emerges and I have concrete evidence of that. That's why I'm not revealing that. But because I don't want to sound foolish, and I understand why it may seem like a out of the blue very stupid thing someone is saying, but that is also a factor. Someone doing malicious harm can be a factor in anyone's life. If you have a business rival, they could want to introduce some chemical in your food to make you drowsy, to make you less functional. That could be some person's reason to poison you. There could be, and then someone was wanting maybe to poison you at a harmless level, or at a level where they will only get one slight advantage about it, but their slight harm that they are thinking might just be a very casual harm or one time harm can escalate into a big harm, like how it escalated for the baby Uriel. It's just that every person, I feel that is what happened. Everyone thought they're just doing a minor level thing, or they were just making a personal issues based choices. But those personal issues based choices only eventually added to the combination of circumstances leading to her slow health harm that many people didn't understand, and then some health harm that was understood but also misdiagnosed on the day of her death, I believe, or misunderstood. And that misunderstanding can be very easily cleared by doing the appropriate test, even now, of the locality, of the family life, and of other already gathered evidence. I hope this makes sense. And then with the mother, I keep wanting to go towards this topic and I keep forgetting, because this is also important aspect, that when I said that there are certain people who can be very mindful parents, very over careful and over cautious parents, but there could also be other parents who are not that over cautious, over mindful at the conscious choice level. But subconsciously also, universe still is working for us and protects people. So when this mother is occasionally, thinking of for home related activities only, she goes back home. Part of it is also her subconscious choice why she wants to go back home. If you look at her testimony only, the way she was asked a question, the prosecutor was wondering, like, why did you only send your daughter 1 hour? Like many times, if you are doing temporary babysitting, some people will give the daughter to the mother for 1 hour and then go and bring back the child again, right? Some people can make that choice, right? But she doesn't do that. She makes the choice of keeping the child at the grandparents' home for 4 hours. Why? That why is necessary because it might be a very subconscious why she would let her child stay with her mother for longer time. Because if, let's say, she stays in a, and I think they were living in a apartment like housing. So if she's staying in an apartment like housing where maybe mold problems are there, where maybe water pollution problems are there, she may not consciously know those problems are there, but subconsciously it has been impacting her health, her child's health. So because it's subconsciously impacting her health and her child's health, and maybe the home in which the mother stays has more cleaner, health supportive environment for the baby, That's why subconsciously she is driven to not stay in. And if both their health are being harmed by some business activities that are going on in their business, where inhalation of microparticles are indeed impacting their health, that subconscious pattern is emerging in her, causing her to only work in the office for only 4 hours and then take the rest of the day in her home, where she's doing house caretaking chores, child caretaking chores in her home. And sometimes when she needs some help, when she's feeling overwhelmed and tired, like not overwhelmed like in the conscious physical psychological level overwhelmed, but your body can also get overwhelmed when multiple toxins are there in your body. At the physical level, physiological and biological level, your stress responses in the body can increase when couple of different stress related elements are there, not just the social aspects of child caretaking or social aspects of business or socioeconomic aspects of business related work or family life related work. That is one factor that influences the overwhelming that sometimes women experience or feminine energy experiences. But other than that overwhelm that you can experience when too much life problems or too much activities have to be done, which is not possible for you to do given the number of hours of the day. But other than that, biochemical and physical overwhelm and stress response happens to us when we are accumulating toxins from various sources. It can be physical toxin like microparticulate matter from construction. It can be mold poisoning related physical and microbial toxin. It can also be chemical toxins from your water and local environments. And it could be a combination of all of these overwhelming your system. That's why her mother also, Uriel's mother, her blood test also needs to be done, and I know which kind of parameters, if tested, will prove where she had the overwhelm from physiological toxins or chemical toxins, where the overwhelm was just a overwhelm of being a mother caretaking a few kids. All of these, and you can very easily pinpoint, or I don't know about other people, but some aspects of this discernment regarding what aspect of her behavior is coming from her being overwhelmed as a mother caretaking many children, what aspect is coming from her being a business person doing business activities, what aspect is coming from direct physical toxin, chemical toxin, microbial toxin impacting her health. All these distinctions are needed and necessary for both people who are investigating crimes related to socioeconomic factors, and people who are working in legal and justice system, and also people working in medical and healthcare delivery systems, to distinguish between patient related factors. Because this is a challenge I have also faced, where people are attributing sometimes, like when I am stressed, that she is a normal woman who can be hyperbolic and very melodramatic or over dramatic, when I am not that over dramatic personality. I am a very verbally sometimes abusive and sometimes very voluble personality, like a strong personality type, where I will not shut down if someone asks me to shut down. Even if they expect me to shut down, my shutdown happens. So my physical shutdown also, that's why it's a very abnormal shutdown. I'm not the kind to physically just shut down and not do any activity if emotionally and physically something is not going wrong, right? So I'm not the kind to just shut down because someone expects me to shut down, or like many women, they keep quiet when or suppress their emotions when some injustice is going on or some problem is going on in their life. I do not do that, because I saw my mother all the time being quiet about her problems, and in 20 years only 2 or 3 times I saw her speak about her problems. So if I've gone through a life where and knowing a woman has many problems, but she was only speaking 3 times about her whole set of problems, which were really complex and deep. If I've seen someone do that, I'm going to be a opposite type of a personality only, who will speak majority of the time and keep quiet only about the crucial places where I should keep quiet. So I do keep quiet, and that's why only I'm keeping quiet about the factors which until that can be, whatever factors I've spoken here in all my videos, they are all provable factors, very easily provable factors. The factors that I can't prove right now are the places where I'm keeping quiet, because for that, if someone else needs to gather the evidence, until that evidence comes up, I can't speak about those factors. Knowing, even though I know that those factors are important factors in determining all the factors related to my health status and my health decline, while I know it and I can explain it to a doctor, but if the doctor doesn't trust me, they will not come to the right conclusion related to my health. Secondly, if the doctor trusts or doesn't trust me, if I get that right diagnosis from a doctor, get the right treatment medication from the doctor, if the doctor doesn't understand that, in Nicole's case, Uriel's case, when Uriel was given, please check if there's some Nicole patient right now in the world who's going through some similar health distress. Someone needs to check this. I might check it, Google it up, I don't know. But I don't know why God keeps telling me to say Nicole. But in Uriel's case, when Uriel was given possibly some drugs to, for her breathing purposes. Understand this is also an important factor. Like, if say they assume it as allergy, so for allergy they gave anti-allergy medication. That's why, while some of her cheeks were showing redness from other allergic responses to other chemicals she might have been exposed to, rest of her body may not have shown that heavy level allergic response. Why? Because even if there were 10 allergens that her body was getting exposed to from different sources, because the doctor assumed she has some allergy problems, or her parents assumed she has allergy problems and have given her anti-allergy medications, then what is going to happen is the allergic response to those chemicals now has been toned down because she's taking medications. So in case of, like, if there were two babies, both babies had similar exposure like Uriel had to chemicals in her local environment, house environment, but one baby gets anti-allergic medication, another baby doesn't get anti-allergic medication, then the baby, and both had very similar, like 5-10 similar chemical microbes, toxins that are influencing their health, the baby who didn't take the anti-allergy medicine, that baby's body will show more symptoms of the diseases and conditions impacting their health. Whereas the baby who was already taking some medication for some allergies, those allergic responses now will not show up at a starker level. It will be subdued because she's already taking a medication for the allergy. Second thing, if they thought she had a lung infection because she was coughing or sneezing, and for that lung infection, if she was given, and this could have happened 2-3 months back. I'm not saying that this happened on the day she died or on the week she died. This medication usage even a month back or 2-3 weeks back can also have a latent impact in your body a few weeks down the line, few months down the line, depending on what was the physical status of the baby. Normally a medication might get cleared up within 1 week after you have stopped taking it. But if, say, organ damage was developing, that same medication that should have been cleared up from the blood of a baby in 1 week may not get cleared up, might be there for 2-3 weeks. There are other medications that do have long lasting impact, and if the mother was taking, let's say, antidepressants for postpartum depression, her antidepressants that the mother is taking, some antidepressants stay in your body for 3 weeks. So those antidepressants that are staying in your body for 3 weeks, if the mother is taking it, it's there in her breast milk, the baby is getting exposed to it, and if she has also weaned off, let's say after 6 months the mother weaned her off from breastfeeding, even then is there a potential for after 1 month for that baby to have some of the breast milk content still in the baby? It is possible. So all these factors do need to be looked at, and then it is also possible, while some medications stay in your body longer than 3 weeks, there is also a possibility that they can stay, even if in a healthy person it stays longer than 4 weeks, 3 weeks, in an unhealthy person it can stay longer than 6 weeks also, because then when you are unhealthy, like slowly developing some factor related to bad health that has not yet been diagnosed, again, if diagnosis doesn't happen, doesn't mean that some bad health harm was not manifesting in your body. The diagnosis is the day when extreme health harm was there, and that's why something was diagnosed eventually. But until that time point, slowly some health harm could have been manifesting in your body, which could have been leading to some chemicals staying longer in your body, some chemicals doing greater harm than they would have done if you were a healthier child. Does that make sense? So that is also important relevant factor in Uriel's death, or any other children who are severely hospitalized, experiencing something which doctors are not able to understand what they are experiencing. Or, and again in Uriel's case, one third factor, if she had some flu like symptoms a few weeks back, and she was given some flu medication, related medication, like, or she had breathing distress, and that's why they gave her an inhaler for breathing easily, or a corticosteroid was given for helping her breathe easily. What does corticosteroids do? Corticosteroid inhalers or tablets or any other form that she was given for taking that corticosteroid, any of those drugs can cause reduction in inflammation. And that reduction in inflammation is necessary because when you're coughing or sneezing or having symptoms of breathing symptoms, it is assumed that and it's generally the truth, that your respiratory tract and muscles in your respiratory system are clogging up. That's why you're having a difficulty breathing. So to ease your breathing, to help you with your coughing, anti-inflammatory factors are given so that the inflammation will go down. If the inflammation goes down, your coughing might go down. If the inflammation goes down, these constricted, like what is happening when you are having breathing distress is my respiratory tract, like let's say this is my trachea or other the branches. I'm right now blanking about physiology. I'm so sorry. But you know how a lung functions, right? We have, this is my lung, this is my trachea, and on these two sides we have these two branches of my respiratory tract. This branch will go to my left lung, this branch will go to my right lung, right? And this area, this branch that is formed, like how a tree has a branch, like that we have a branch in our respiratory system. So this branching that is happening, any area of this, and after this also there are micro branches that are happening. So this branching and division of our respiratory tract that is happening, any of these places, constriction of muscles can happen, blocking of muscles can happen due to inflammation, blocking of the tract can happen due to inflammation, causing you to have cough or respiratory distress. Now when anti-inflammatory drugs are given, it is opening up, okay, or any other beta blockers are also possibly given. It can help you in opening up this clogging of your, like if inflammation is there, the inflammation will clear, and that will help in easing and opening up the clogging, and the breathing distress will be relieved. If some other muscular factors are there, that's where beta blockers, alpha blockers, those medications will be helpful in causing you to breathe easily. So while these normal breathing enhancing drugs are being given to help in clear away the inflammation, to help in easing the muscular constriction, people don't understand this muscular constriction is a safety mechanism also that the body is doing if you are breathing too many harmful ingredients. So if you are breathing, minorly, occasionally some pollen, occasionally some virus, occasionally some bacteria, occasionally some allergen in your atmosphere, and if your breathing gets cleared, it helps with your health. It helps with your health because you also need oxygen. If completely your respiratory tract gets blocked up and choked up, you can't breathe. If you can't breathe, you don't have oxygen. If you don't have oxygen, you will die, right? So that's why opening of the muscles are necessary. That's why these anti-inflammatory drugs and drugs for helping you breathe better, for lung infections, for flus, for allergies, those type of medications are given to you. But now when you are not you are having heavy air pollution related parameters impacting your health, at that time point, if my muscles now open up, that is a health harm enhancing factor. Why? Because now that these muscles have opened up, it can't prevent the physical toxin from entering my body. So microparticulate matters of glass are continuously entering my body, and glass's impact on my health is much more severe than what a microbe will impact, because glass can collect and accumulate in any area, pierce your organs and cause internal organ piercing. Not just glass, any very sharply toxic material, if in your air there is some chemical that is very sharply toxic and can cause chemical burns, those kind of things, if they are entering your lungs, those are all very extremely distressful conditions, where if you give medicines to ease your breathing, at that time sometimes if too much easing of breathing has happened, too much, you will not now that easing of breathing has happened because of medications, you will not be coughing, and everyone will be assuming because you're not coughing, because you are not having runny nose, because you're not having red eyes, because you could have a combination of medications given to you to reduce the redness, reduce the inflammation, reduce the allergy, in help you with breathing. So these combination medications that have been given now show visibly to the world that you are healthy. But while the redness is not showing up because antihistamines have been given, while the cough is not showing up because anti-inflammatory has been given, while the ease of breathing is happening because the muscles are now relaxed by the drugs given for inhalation purposes, all of it is helping you in looking healthy, but you're not really healthy, because at the same time simultaneously you're breathing mold, you're breathing possibly potentially for Uriel, I think she might have breathed mold, she might have breathed air pollution related other contaminants, and she might have breathed some construction related contaminants in her lungs, all of which when accumulated in her body is slowly declining her health without anyone being aware that she is declining in health. And this thing very important for all children of this modern century, for all children who are suffering like Uriel, all children who are going through some health challenges that no one is able to discern, simply because our understanding of biology, understanding of medications, understanding when medications are beneficial and when it may not be as seemingly beneficial as it used to be previously. This would have been beneficial when we didn't have greater number of toxins impacting our health and only microtoxins were there. Then giving oxygen is more important, and if a little bit of bacteria or fungus or mold or allergen entered my body, it would have been okay, because my body's defense system is healthy enough to fight those microparticles while I am easily able to breathe. But now that I'm not easily able to, neither am I easily able to, I'm maybe easily able to breathe oxygen, but along with oxygen I'm also inhaling mass amounts of chemicals or toxins, microbial and microfiber toxins. All of these are slowly accumulating continuously in my body. And imagine like how I have had health issues from multiple microscopic, unseen to the eye but very visibly logically derived toxins in the environment. Some are unseen, some will be seen when enough of it accumulates. Like in my home, for 1 year 2 years I have gone there, tried to live there, because a lot of cleaning has to be done anytime construction is settling there, dust is settling there, I come back. But there's a lot of dustiness that settles in my home when for 1 year no one is cleaning the home. So that 1 year's level of toxins that is accumulating in the home shows that is the level of air pollution of that area or of that particular building. So that level of air pollution, while every day I might be cleaning and dusting of the tables and wiping of, maid is wiping of the floors and vacuuming other parts of the homes, when while that is happening, microparticles of those air pollution contents are also getting inhaled by me regularly, and which is what was impacting my health slowly over time. And for me, I am a healthy adult with 60 plus kgs weight, and this baby was only possibly 6 to 10 kg weight. Imagine what happens to a that much smaller, 10 times smaller size baby. Does that make sense? So when a 10 times smaller size baby is there, that same content that is causing me such great breathing distress and such great functional ability related problems, imagine what it will do to a smaller size baby in that same area with the same conditions. And is the same conditions that are impacting my health same as Uriel's? No, maybe 50% that, but still 50% conditions might be similar. And even with that 50% similarity in conditions, globally there are many other children, if they have even 50% similarity in health status related to what was going on with Uriel's life, that many places where you have similarity with Uriel's life, those are the places where those children's parents, grandparents, caretakers have to now start becoming more mindful, more aware about what are the next stages and steps that need to be taken to ensure the child stays healthy, ensure the child is safe, ensure the child is physically and chemically safe from certain things. And some of these changes have to be done at the personal family level, some of them has to be done at a social societal level as well. So I hope this made sense. Anyone has questions, comments, please drop a question, comment. If you would like to connect with me, in the description section of my page I have put some social media pages where you can connect with me. Thank you very much. Have a great day.